Hi everybody, I'm Pauline Coffey, the Manager of Partners in Recovery North Brisbane, and this is our next podcast update to let the sector know what we've been doing in Partners in Recovery. I'm sitting here with Belinda Chelius, who's the Senior Support Facilitator from Communify, who's one of the agencies implementing PIR. And I've asked Belinda to talk with us about some of the partnering work that Communify has been involved with in the inner city. So thanks Belinda for your time.
Thank you, Pauline.
So you've got some examples, particularly around alcohol and drug. Can you tell us what partnering work you've done there specifically?
So we've got a really good partnership going with a big NGO called Queensland Injectors Health Network.
Yes.
And which has been great. They've given us access to primary health care through their GP clinic.
Yep.
Which has really been great for our clients. It's a very safe environment. Through the GP clinic, then that MOU also states that the clients can enter into treatment, which is group and counselling.
Wonderful. Excellent. And there's also been some work you were talking with me about in regard to culturally and linguistically diverse clients. Often a hard to reach or meet group for people with severe and persistent mental illness. So what progress has Communify and PIR made in that area?
We've identified through our multicultural worker that there's definitely a gap for multicultural workers to actually connect and work with these clients in their own language, who understand the culture and really build a non-threatening, trusting relationship due to the trauma that they have suffered. So we're working at brokering some of those multicultural workers to assist PIR while we're doing the care coordination and service integration.
Okay, some good examples of the layering of services. And so you've also been working hard with the hospital, the HHS service, and we often know that there's big gaps between someone within hospital and then their discharge sort of planning, and then there's care and support needs. So what work have you been doing to try and reform some system approaches there?
We've had the opportunity to go onto the ward and actually see our clients while they're on the ward and do some of that discharge facilitation with the treatment team. So action plan happens before the client leaves. They meet us before they leave. So there's really a very much a holistic recovery based focus.
Wonderful. That sounds very positive. And there's some group work that you've been trying to also develop.
We've got a local partnership agreement with the RBH around systems change and better support for clients with severe and persistent personality disorders, which also links to a partnering with a private psychiatrist to help us with this pilot project.
Wonderful. Okay, so there's some examples in only 6 months. So thank you very much, and we'll talk with Anita.
Yes.
Okay. I'm sitting here with Anita Burtgar, who's a support facilitator with Communify Partners in Recovery. Anita's giving us a little bit of her time to be able to talk about her work as a support facilitator and how she goes about that particular role. Thanks, Anita. When you first meet a new referral, a new client to Partners in Recovery, how do you describe what you do?
Yeah, Pauline, I guess when first meeting a client, I just explain to them what Partners in Recovery, the program is. So I'll say, hey, look, we work with people experiencing troubles with their mental health. And when you are experiencing troubles with your mental health, it can often be difficult to navigate the mental health system and to work out who you can connect with and how you can do that. So I guess I tell them that my role is to sort of help them to do that.
Fantastic.
So to link them in with all of the different services and supports that they might need.
Okay, yeah. All right, so you're the navigator. And so I know that Communify is particularly keen as a model of working is outreach. Can you talk a bit about that?
Yeah, well, outreach, I guess, is probably one of my favourite ways of working because it just feels more natural, I guess. And I think it's much easier for the clients too. So
you go to services, where people are.
Exactly, So we can meet them in an environment that's most comfortable for them. So for example, I might meet them at a barbecue, or meet them at one of the housing services. They often have social days, so they're in their own environment, and it's easier for them. They're more comfortable.
It's a pathway. Okay. And so from these ways of working, have there been some outcomes that you think are positive in the recovery of PIR clients, Anita?
Oh, absolutely, absolutely. So, for example, we've been really successful with getting people housing, which is a big one, especially as the colder months approach us.
Yeah.
I've also, one of my favourite things, I think one of the most useful things, is to link clients in with social activities and groups, because they so often become socially isolated.
Yep.
They don't have friends, they don't have those supports. So it might not necessarily be mental health professionals that we're linking them in with. It could be really simple things like maybe an art class, just to get friends, just to remember the things they used to enjoy doing and get them back into that.
Thank you very much, Anita, for
Welcome.
giving us an outline of a support facilitation role at Communify.